used in labor. Remember, and I think I told you, maybe I didn't, because we didn't really go into magnesium, but magnesium in labor is the only thing, we did kind of talk about it, but it's the only thing to keep somebody from having a seizure who's preeclamptic. It lowers the threshold of the seizure, okay? So we use that often in labor for someone who's preeclamptic. Again, we're going to go into that much later, but you might see magnesium in labor and delivery, but we're going to talk about preeclampsia later. We used to use magnesium for preterm labor to stop contractions. We do not, because it does not work, but we still use magnesium in preterm labor because what it does do is it reduces the incidences of cerebral palsy by at least, I want to say it's 10%. So out of babies who would have had cerebral palsy because of preterm labor, it is a neuroprotection by at least 10% reduction in cerebral palsy to the newborn. So you might still see magnesium being given for preterm, but it's not to stop labor.
It's to prevent cerebral palsy.
It's to prevent cerebral palsy. It's to prevent the brain damage that goes along with the baby being born premature.
Wow, I didn't know that.
However, we can stop contractions with the use of breathing, okay? Also called terbutaline. And so we can give someone in preterm labor. Now we're going to find out why. And what are the two causes of preterm labor usually? Infection and dehydration. So we're going to treat that, but we need to stop the contractions.
What did you say you give to stop contractions? Is that word?
Breathing or terbutaline.
Breathing.
Okay? What you need to know about breathing is that it causes an elevation in heart rate to mom. It causes them to have anxiety. It causes them to feel anxious. All of those things. We can actually give it every 5 minutes, as long as her heart rate isn't too high. So you're not going to give it if someone's heart rate is already 110. Okay? It can cause tachycardia also in the newborn, because it does cross over into the placenta. Okay, so that's one of those medications that you might have that tachycardia in the newborn. Babies should have, most babies will poop every time they eat. You need to have, a newborn needs to have at least one bowel movement a day. Most of the time they'll have like 3 to 6 a day. Remember, poop, the first poop is the meconium, if they haven't passed it in utero, and it's black and tarry. The only time you can possibly have black tarry stool without worrying, okay? And make sure Dad changes the first paper.
At least once a day.
You know, because it's sticky and it gets everywhere. Yeah.
If their first bowel movement is not black and tarry, you can probably assume that they had a bowel movement in utero. Okay.
Yeah. So, and really all it is it's the cells from the intestine. The GI tract is sterile in the newborn, and thus a sterile intestine does not produce vitamin K. Okay? So, vitamin K is important. They've gone through a traumatic event. They can bleed. We want to make sure they get their vitamin K. So we give babies vitamin K at delivery. There is a study going on, especially in the military, that it shows that it's only helping about 1% of babies. So a lot of military bases aren't even given the vitamin K anymore. And I'll spare you the story about a resident who asked me about it. So, just because I don't have time. So voiding, a baby should void at least have 8 to 10 wet diapers a day. And if it's not, it could be a sign of dehydration. Okay? So baby must poop and pee. When we're doing this skin to skin with mom, we do kind of want to have kind of a quiet environment, but we do not want to discourage bonding with the family. Okay, so keep that in mind. Oxytocin. Does everybody know what oxytocin's for? Women actually produce oxytocin through breast stimulation. Okay, so it is a normal hormone, but we can use oxytocin for induction. And remember, when we're doing oxytocin, what is really important to do? Monitor the baby, because again, a woman in labor, yes, we monitor everybody now, but normal labor is not going to cause overstimulation.
So,
But if we're giving her oxytocin, then we might cause abnormal contractions.
so a mother can actually stimulate their own oxytocin through breast stimulation?
Yep.
And that's how I know in labor.
That's why they discourage
Unless you're ready
before
for
sex, before if you're at risk for preterm labor.
Did not know
It
that.
doesn't, I mean, it's not long term. Okay, so once it stops, it quits and the contraction should stop. But we actually do a breast stimulation contraction stress test, where we actually have a woman stimulate her breast to produce contractions rather than us giving her oxytocin. Okay? So again, we need to monitor the baby, and if we're ever going to increase, before you increase, you better make sure your fetal well-being is good. Okay, those 4 components of your assessment in the fetal heart tones, and that you're not already overstimulating. You must have at least a minute break in between contractions. Okay, you must have at least 1 full minute in between contractions for the baby to recuperate. Okay? Magnesium we talked about as a muscle relaxer. Obviously, there's a fine line. It lowers the threshold for seizure activity. That's where you're going to really need to know about it. If someone's toxic, they're going to have low respirations and decreased deep tendon reflexes. Does anybody know why a woman might get betamethasone in labor?
Good job. Toxic what?
Lung maturity for the baby.
Okay.
Okay? So if a baby is going to be born early, we want to make sure that we give that baby the best chance, and so we'll give them betamethasone. The studies show that they need at least 2 doses, and that the second dose really should be at least 24 hours before they're born. It increases the maturity of lung development, but it's not long term. So if somebody's premature and then they don't really deliver and they got steroids, then they might have to get steroids again, or it may not. If they do deliver early, 2 weeks later, again, we don't know. Studies don't show that there's a whole lot of benefit to it. After delivery, if a baby's born and is having respiratory difficulty, then we might use surfactant. And surfactant is actually what we have in our lungs that premature babies don't have when they're born premature, and it's a lubricant, essentially, to allow the lungs to expand. Okay, and if they don't have that lubricant, their lungs can't expand and they can't have oxygen exchange. So we can give surfactant to babies after delivery to also help. Okay. So I want to talk about cultural differences real quick. I know y'all are going to do that with peds, but we have to remember that there's a lot of cultural differences when it comes to labor and delivery, and we have to be mindful of it and respectful of it. If it doesn't go against the hospital policy and it's not going to harm the patient or the baby, we can't do anything. So some of the things I've had is right after delivery, I've had dads want to put bracelets on their baby's arms before they were bathed. But I had to let them because it wasn't going to do harm. Okay? I would not let somebody put anything around the baby's neck. Okay? But it was a bracelet. It was their thing. I actually had someone bring honey, and in their culture, they had to give the baby honey right after delivery. That was their culture.
You're not supposed to give that to
I
a
know.
year or older.
So what do?
You tell them no.
Right. That could cause harm, and so I cannot allow it.
Was it raw or pasteurized?
It doesn't matter.
I don't know.
If it's not raw, then if it's raw, then it, like, don't give them raw honey. But
Right.
if it's not,
Right.
then it was okay.
So
we don't
again,
give them raw.
but I didn't know, So do you think he did it after I turned around?
Probably.
Don't do it in front of me, right?
Do it when you go
first. Again, it's something that we, in some cultures, the mothers and the grandmother makes all decisions
What?
and takes control.
Hell no.
Absolutely.
That ain't
So if
happening.
you see that, are you gonna intervene?
No.
No.
I'm just gonna go,
No.
you crazy.
Or
No.
is it-
Huh?
Depends on-
So can you
it's
ask?
The first 30 days for, I think, India, the mother and grandmother, of course, in China, they do everything.
Everything for the patient.
The mother does not see the baby, does not bathe, like, there's very specific.
There's some
cultural norms.
cultures that hot and cold matter. So when a
I've
woman
heard about that.
is menstruating, she's supposed to only have, I think it's cold stuff. But
Yeah.
when she has a fever, she's only supposed to have hot stuff.
It's
Feed the fever.
So you can
it
see how
represents something. I don't remember
right.
what it is though.
So
but
you
I read
can
an
see how
article.
that can be very
So can you just ask
important in
them
labor and delivery.
at the beginning, like, hey, can you tell me about your cultural?
I'm
Well,
pretty sure they'll tell
Yeah,
you.
and they'll tell you. You just have to be mindful of it. I mean, so again, if Muslims, men cannot come in the room when their wives are without garb. So can you imagine how the anesthesiologist is a man? I know. Like, can you see some of the challenges that you might face in labor and delivery? When a patient is there long term, in the Muslim faith, they pray every day at the same time of day. So you have to avoid that time when you're giving care to the patient unless it's an emergency. Okay? So again, we have to be very mindful. And it's not just necessarily culture, but it may be something that's just like, oh my God, I've had dads go into the delivery with their daughters, and that's hard for me because it's like, I don't get it, but that's his baby, and, she's having a baby, and so we just have to be okay with it. Okay, so it's not just cultural differences, but it's also other things. And then adoption.
Oh.
So I've had a lot of deliveries where the adopted parents come. The mom's giving her baby away, but she still wants to breastfeed.
I would cry like a baby.
She wants to give her baby the best chance. So we have to be mindful.
What if
And
the
it
adoption
happens.
parents wants the baby to get that first?
They can't force mom. They can't. And I've had moms say, I don't want to see him. I don't want anything to do with it. Take the baby out of the room as soon as it's born. That's their choice.
Wow.
It's probably the way of coping.
So again, lots of things to remember that we have to be very mindful, and we have to be respectful of the person's decision, okay? And so remember that when it comes to cultural differences and diversity. Let's see. When you're doing a newborn assessment, you'll learn yourself. But until you're in clinical, I'm going to tell you, do the least invasive first. Because if you get that baby rolled up, good luck. Okay? Because you're not going to be able to hear anything. So do the least invasive first when you're doing an assessment. Guys, and some of the things you really need to check out that we didn't go into is you need to make sure the spine is completely closed and that there's not any hair at the base of the spine, because that usually is a sign of a possible, what is it when it doesn't close? Spina bifida, thank you, is just a little hair. And when I say hair, I'm talking hair.
Is it
Okay?
like,
It's like
on their back?
hair. It's all the way at the base of the spine.
So it's not like peach fuzz.
It's not peach fuzz, it's hair.
and it's a sign of,
Spina
Spina
bifida.
bifida.
Okay. It's just that, well, it's in the development.
Like a horse.
Part of the scalp ended up where it wasn't supposed to. Okay? You have to make sure the rectum is open. So you know it winks when you stimulate it. But you have to make sure it opens, and until they actually have their first BM, you're still not sure. Okay? Because again, it could be just a malformation. Heat loss. Let's go into heat loss, because this is important. And then I need to talk about
How you spell spina bifida?
transition and locia. So heat loss, there's 4 types of heat loss: conduction, convection, evaporation, radiation. Thank you. Okay,
I figured I'll get it
it's
later.
hard to remember, but I guarantee you, you'll be tested on it.
say that again.
It's hard to remember, but I guarantee, there's 4 types. You want to hear it again? Convection, conduction, radiation, and evaporation. Thank you. See, it's hard for me to even remember all 4. Okay. So we covered evaporation, and we covered conduction. Conduction is whenever you have a cold surface and a warm baby. And so the heat is going to go to the cold. So your baby's going to lose heat. Evaporation is through moisture. Convection, and these 2 are kind of hard. Okay, so convection is through wind, right? Am I right?
Room temperature.
It's when ambient temperature is low versus
Cool room temperature.
Agreed. So that is when you have a fan in the room.
radiation.
So you want to make sure there's no fan going on, okay? And radiation is being by a cold surface. Okay, it's not actually being up against it, but it's being by it. So that would be your cold room, okay? Versus, so you want to make sure you know how to identify them. Okay? Far warning.
Radiation is lost heat.
Okay? The most important, guys, is when we dry the baby, we're getting the moisture off. We always make sure that everything that touches the baby is warmer than the baby, and everything that we place the baby on is warm, okay? And it's important to know that. It's important to know that. Lochia, the reason I want to cover it is because we didn't quite go into it.
What'd she say?
So lochia, does everybody know what lochia is?
No.
Lochia is what we call the bleeding after someone delivers. Okay? Rubra is initial. It's bright red. Then it turns to alba, which is more of a mixture. It's still red, but it's not bright red. It's not active bleeding. Because is alba active bleeding? Remember what I said is inside the uterus? There's a wound there. It's open. And remember, just like in a wound that's healing, it'll have drainage. So I want you to think of that when you think about lochia, because there is a wound. There is a huge gaping wound inside of her. Okay? Yeah, I think it's important for them to put nothing up there for 6 weeks until it heals, absolutely. Lochia can continue for up to and sometimes past 6 weeks after delivery. You see why? Because there's a huge gaping wound in there that's healing. And then it's rubra, alba, and serous. And serous is just what it is. It's more of a drainage yellow discharge. Really not bleeding, more of just a wound drainage type thing. Okay? The bright red. There is something you need to know, the normal process. But again, if it falls out of normal, we only worry if it goes backwards. Okay, so if she's serous and all of a sudden she starts having alba, that's a problem, right? Because all of a sudden she's bleeding it. What?
In our book, it says the semester is just ground coated.
Hey, what page is that on, Shay?
Oh, okay, so it's the opposite. I apologize.
Thank you.
So it's the opposite. So the serous is the middle one.
Okay.
It's alba, serous, and then it's rubra, serous, then alba. Very good, thank you. Thanks for clarifying that, because I don't want there to be any question. Now again, we don't want it to go backwards, okay? She also, it would be abnormal if all of a sudden she doesn't have any discharge, right? Guess what? You better ask her about it because she may have put a tampon in.
Oh.
Yep, it happened. So she better be having some drainage on her pad. Okay? Because if it's not coming out, it's staying in. And I've actually had that happen. So again, we need to ask our patient. Oh, look, we've had people have sex on postpartum.
Oh,
You're kidding.
Yum, yum.
In the hospital?
In the hospital.
No, baby.
You didn't do a whole lot of that.
They did go home, I guess.
Okay.
Okay, so,
Pregnant again, she takes a checkup. You hear me?
okay, so now that I'm going to be very pregnant, you can go back. Let's look real quick at the care of the female. Again, you also need to know fundal height, okay, and the progression of the fundus as pregnant as it grows and postpartum. Okay, so as it grows past 20 weeks, the measurement of a woman's abdomen while she's pregnant should equal the gestational age she is in centimeters. So if you measure from her symphysis pubis to her umbilicus, and it measures 32, that means she's 32 weeks.
Nifty.
Anything past 20. Before 20, it doesn't count because it's too much inside. Okay? So from her symphysis pubis to her fundus should equal the week she is as she grows. If it doesn't, then we worry about intrauterine growth restriction. We call it retardation. I didn't like that term. So restriction, and that means the baby's not getting the nutrients it needs to grow, and something's wrong.
Is it true that I know you like
Yep, here it is right here.
It can, it doesn't have to be exact, and you want to know why? Because it's give or take 2 weeks. So again, we know so someone who comes in at 40 weeks might really be 38 weeks, or they might really be 42 weeks. That's a huge difference, especially when it's preterm. Especially whenever the baby's being born around 24 weeks and you don't know if you can resuscitate. Okay, so we'll not even worry about that right now because we're going to talk about that later when we talk about the issues with preterm labor and fetal demise. But now, as far as when umbilicus going down, it's normal to be at U or U+2. Again, remember I said, well, we don't want it going backwards. But remember, if she's on Pitocin, her uterus might contract a lot more. And then once we take her off Pitocin, because in a vaginal delivery, they're only on for a couple of hours. In a C-section, usually they'll leave them on until the next morning when they take their Foley out. But once the Pitocin stops, you may have a little bit of an increase because you don't have the Pitocin there to help with the contractions. But it should just continuously get smaller, lower in the abdomen. U or U+2 is okay initially, but before she goes home, she's probably going to be already just barely above the symphysis. Okay, you should still feel the uterus before she gets discharged, but that's how much it goes down from U+2, usually all the way down to just above the symphysis pubis. Okay, it is fast. It is fast. If it doesn't happen that fast, it could be because of what? Like new baby, twins. Okay, so those are the times you're going to get some abnormalities. You with me?
So,
let me look
on the
here real
Bible
quick
for
to
the
make sure.
symphysis
Is there
Bundles up here.
anything, okay, so one thing I don't know if we talked about is mastitis or sore nipples. Let's talk about that. So,
or nipples.
guys, sometimes babies will use mom's breast as a pacifier,
Yep.
and it can be get very sore. We really want to make sure that we're keeping her from getting sore rather than treating the soreness. But ways to control that is to make sure that when the baby is latched on, that we don't pop them off, but rather that we break the seal with our finger, or teach mom how to break the seal so that we're not popping babies off the breast, because that will cause issues. In God's wisdom, He actually produced breast milk that has a healing product. So if you wipe the baby's saliva off of mom's breast and express milk, colostrum or breast milk, and you put it on her breast, it will heal. I know.
I've read that.
There are some creams and stuff like that that you can also use, but you don't want the baby to get that in their mouth. Okay? So that's something to remember.
You don't want the baby to
Mastitis.
get the cream on there?
What's that?
You don't want the baby
Yeah.
to get the cream? Okay.
Yeah, so you just have to make sure and clean the cream off before. Clean the breast before the baby latches on. And we do want to tell mom, don't let the baby breastfeed every 2 hours because you're going to be sore. And we do say alternate breast because the first latch is always the strongest on the newborn. So if you start
So I'm
with the right one this
confused.
time,
So we
then you go up with
breastfeed
the
bottle,
next.
breastfeed bottle.
That's what I'm saying.
Okay, and usually we'll put a pin on her bra or something. We do want to make sure she wears a good support bra. And if someone is not breastfeeding, you know their milk's going to come in anyway, right?
Yep.
Because we used to give them medication to stop it until we found out it killed them.
Okay.
So there is no medication to stop it.
That's luck.
So, I know. So the only thing to stop it is to actually bind the breast and do everything you can to keep the breast from filling up. Okay? And remember, it's a supply and demand, so no stimulation.
So,
Anything and everything to keep mom from being stimulated. And so a good support bra is what we encourage. There are breast binders that you can put on. We used to put A-straps on. That's no longer the standard of care. So, but you may still see that in the hospital. Okay?
So how long does it take for you to stop?
So, you know the breast milk's gonna come in about 3 days. It usually takes about 5 to 7 days for it to dry up, and it's very painful in the meantime.
I feel like it took
Okay.
longer than that.
Took yours longer. You
Yeah.
just probably was meant to breastfeed. I'm sorry. So, it does hurt. It's very painful. The pain in engorgement, which is when the breasts are filled with milk, is different than if there's an infection called mastitis.
Yes, I had
And
that.
that's when you have redness, swelling, pain. So you see, it was more than just breast engorgement, and breast engorgement can cause mastitis. What is the only treatment for it?
Pump.
Antibiotics. Okay, it's an infection.
So-
And so we have to educate our moms about it.
If we're not supposed to breastfeed them every 2 hours, we're supposed to breastfeed bottle.
No.
Huh.
But your baby should not. Now, sometimes they'll breastfeed every 2 hours, but we don't want that to be routine, because until your milk comes in, that baby's not getting anything anyway. Okay, and so all you're doing until your milk comes in is allowing the baby to pacify on your breast, and so we just want to discourage that.
She's saying don't let your breasts get overfilled.
Yeah. So really, we should let them do that, but
Do what they
then
want. Like,
let them
at
do
the
what they
time.
want, but make sure you're still giving them the bottle.
You don't have to give them a bottle at all.
They don't have to
I'm
eat
so
much when they're first born.
You do not
If you wanna
have to
breastfeed,
give,
you don't give
if
a
you're
bottle. You might wanna
breastfeeding,
breastfeed them.
no bottle. No bottle at all. Just because your milk's not in, your baby's getting what they need.
Thick colostrum.
No bottle.
Okay.
Okay? You give them a bottle, you're going to cause nipple confusion, and now your baby's not going to demand from you. So guess what? Your
They're not
milk's
gonna
not going to
breastfeed.
supply what they need. And every 2 weeks, and this is just a lanyard, every 2 weeks your baby goes through a growth spurt and going to want more. And that's your baby's way of telling your body to make more, because they need more. And so for about 2 days, your baby will get up more often, be more fussy. But guess what? Your supply goes up in 2 days, your baby calms down. But
Everything's
the
good.
problem is we don't tell our moms that. And then the mom gets frustrated, my baby's starving.
That was me with my
And then
first one.
they give them a bottle, that's it.
They're like, he doesn't need to eat. Yes, he does.
Nope.
I was like, yes, he does.
Nope. So that's your baby's way of demanding more. Any other questions? Yes, thank you. I was gonna do the
Never having
W,
kids.
but
It's too much information.
I wrote 72 pages of notes today.
And then I'll
Hey,
you know, this is a great example.
y'all might as well go ahead and start reading.
I started last night.
You did?
Everything.
I did.
I'm a failure. I did the ATI test.
I'm doing that crap this week.